I'm Dr. Jillian Lucas Baker. I'm a professor, a wife, and a mom, and I've struggled with fertility issues.
I'm Sinora Joy Allwood, a holistic nurse, health coach, entrepreneur, wife, and mom. And I've also struggled with fertility issues.
Welcome to A Tribe Called Fertility. Welcome, listeners, to a very special episode of A Tribe Called Fertility podcast. I am one of your amazing and beautiful hosts of this show, Dr. Jill Baker. Today we have Mrs. Sinora Allwood, and we have Dr. Angela Clack back in the house today. This has been a packed week. This show today is going to focus specifically on maternal mortality, and that's also because this week was Black Maternal Health Week, so there was a lot going on. We all were very busy this week, right, ladies? There were so many conferences and sessions that we were blessed to have been invited to, because we're talking about some big time people who are working in this topic and doing so much great work to really address the disparities of maternal mortality, specifically among Black women. So A Tribe Called Fertility, we were able to attend two conferences this past week. The first one was Speak, Move, Change, Race for Change. Sinora actually helped to plan some of the events for that. So I don't know if she wants to talk about that a little bit, and her experience with being behind the scenes and kind of the heavy hitters that were a part of the conference. And Dr. Clack as well was on with us for that. You all want to talk about that a little bit? Like the big takeaways of that particular conference?
Absolutely. I first just want to say thank you to Miss Shamani. Excuse me, I was going to say Shamani. Oh, yes. Rest in peace. But thank you to Shawnee Renee Benson Gibson, who is a previous guest, and she is the creator of Speak, Move, Change, which was a week-long conference. It's still happening, so if you wanted to check it out, you can register. But it's a week-long conference every night at 7 p.m. where different topics that concern Black maternal health and mortality are being discussed. So I did get the pleasure of helping out, volunteering and acting as a liaison on Tuesday evening, which was Race for Change, where we had Dr. Joya Perry-Crier and Dr. Malawa, who were our panelists. And all I can say is blown away.
Mind blowing.
Especially being in the healthcare field, when I see doctors and just other healthcare professionals calling out the problem, calling it for what it is, it's just so refreshing and so inspiring. It just breathed more life into this work that we're doing. It gave more purpose. I learned so much that now in like the Bronx, New York, where we're from, the maternal mortality rate for Black women is now 12. So for every one white woman who dies in the Bronx, 12 Black women die. And that was really just soul stirring, to hear.
Yeah, it's just like we still have family and friends in the Bronx. Those are, our people, our sisters, our community. And so to hear that was just really just gut wrenching.
Gut wrenching. And now we usually say it's 3 to 4 times more likely for a Black woman to die during childbirth, but now it's 2 to 6. So they're kind of changing the way it's being framed because of areas like the Bronx who have a really high number of maternal mortality, Black maternal mortality incidents. So it was just, man, again, like you said, gut wrenching. And I learned, took so many notes. So I felt so privileged to be involved and be present in the moment.
And definitely more affirmation that what we're trying to do with with the show, we are on the right path and that there is purpose for it, and that to have a seat at the table and us kind of be new in the whole field, and we're just being welcomed by everyone who, you know, has been in it for years, decades. So for us, it's just humbling.
You know, Dr. Joya actually founded Black Maternal Health Week. So that was
I don't think I knew that.
huge for me. Yeah, that was huge for me because I was like, oh my gosh, like this is, you know, this is the work. Right. And she's the creator, but she's just so down to earth. She's just, you know, she's just like you and me. And it was just amazing, you know, to see, just to be there, to be present again, you know, and thank you. And thank you for all the work you do, you know, it's amazing. And Dr. Clack, we attended a conference with you as well.
Yeah. So another group that has been known to me for a couple of years before the pandemic, I was able to go to their conference, which was in Washington, D.C. So this is part of the Black Women's Blueprint. And they do a number of conferences. They do a number of, they do a lot of research too, because I got there, if you remember, one of the things we got was to download their white paper report, which is really thick. And it has so much information on there, from trauma, talking about general trauma through birth, maternal trauma, all the way up to treatment and intervention and research. And it is such a comprehensive report. So if you go back, just make sure you guys download it. There's a ton of information in there. But this week, they also did a number of Facebook Lives, and they're always powerful. There's so much support in those rooms. If nothing else, once you get the information, because we can get the statistics and we can get the numbers, and we are alarmed by them. In fact, I'm pulling up one of the ones that I see here. I'm in New Jersey. So New Jersey is in one of the top 10 states where the maternal mortality rates are rising. So we have Louisiana at 58.1 deaths. All of these are per 100,000 births. So it's Louisiana, Georgia, Indiana, Arkansas, New Jersey, Missouri, Texas, DC, South Carolina, and Tennessee. So those are the ones where the rising rates from 58.1, and the lowest would have been Tennessee with 26.7 deaths per 100,000 births. That's alarming.
In this country, it's alarming. It's absolutely alarming.
It's nuts. I just got chills while you were reading that, because just to take it all in, it's like, you know, I'm always blown away to hear things like this, because with all the medical advancements that we have in this country, with this great medical system, this healthcare system, this makes no sense. It makes no sense.
And I think some of the main messages that everyone was saying in, I think, all the conferences that we were going to, and as a researcher, I can say it's refreshing that in this field and on this topic in maternal mortality disparities among Black women, that all the scholars and everyone in this work are saying the same thing. And so there's no differing opinions. There are no outliers. And essentially that it's implicit bias, racism, and discrimination that are responsible for these disparities. No outliers, nothing else.
Period.
That's it.
That's it. And that's a really, really, really poignant fact that you just pointed out, because very rarely do you have situations where everyone's on the same
page. Right. It's not related to health. No, not in medicine, nursing, public health. Nope.
Everyone's on the same page, and that it's systemic racism, period. Systemic racism.
So part of it is like there's some hope, because you're like, okay, we know what it is exactly. Right. And it's not 10, 15, 25 different things. Right. But the nuances of it are so hard to untangle and to try to create interventions for, that and just so embedded in our society that that just makes it a bit more complex in finding solutions. But at least we know what the issues are.
Yeah. And then, like they used to say, knowing is half the battle.
Right.
Yes. Yeah.
So that leads us to our show topic today and our guest. Interesting situation in turn of events this week. We were contacted by this family. So I just want to give thanks, for this opportunity and the universe for this platform that we've created and being able to be used as vessels to tell these stories. So we're going to be talking with the family of a young woman who lost her life to maternal mortality. Her name is Demi Dominguez, and she died due to complications of preeclampsia. And also her child passed as well, Malakhi. And so we're going to be talking with her mother, Miss Tracy, and her fiance, Xavier,
yes. Yep.
and Xavier's mom. So, just a brief summation.
Well, we were going over the stats yesterday.
Okay, sorry. So if you want to do stats, I'm sorry.
Oh yeah, no,
I got
I'm
lost
just
on the
I don't think we
outline.
need to belabor people with stats so much.
Dr. Clatt just gave stats, so we could pretty much just move on.
In terms of one thing about preeclampsia that I think everybody should know, 60% of preeclampsia related deaths are preventable. This is straight from Preeclampsia Foundation. 60%, folks. Okay, so for the most part, that's easy. That means that women do not have to die. Okay,
that's it.
Period.
These are preventable deaths.
Right.
So
do we want you want to bring the family on, or
should
we do?
Or we can, and I'll start reading. Maybe do you want to do the intro, or you want me to read it? Or
I can do it.
Okay. It's fine.
All right, folks. So Demi Dominguez was just about to graduate from Cal State Bakersfield with a bachelor's degree in psychology. Demi was 23 years old and pregnant with her first child, Malakhi, as we know. At 33 weeks of pregnancy, she started to say and express that she wasn't feeling well. And she had high blood pressure, blurry vision, and other symptoms. And she was told that she needed to be kept overnight in the hospital for observations. But what ultimately happened to her is that she died of seizures known as eclampsia, which is a worst case development in preeclampsia cases. Demi's mother and fiance want to hold the hospital accountable for failing to prevent her death. But they soon found out about a 1975 law that caps survivor compensation when a mother dies at just $250,000, which is nothing. Because of the cap, families often can't find legal representation because it costs so much to bring a case as they could ever hope to recover the costs. They did find an attorney, but only because they agreed to pay all the costs out of pocket. And it is more than Demi's mother can afford, but she still persists because Demi deserves justice and because no mother should suffer from the same fate. So today we have the privilege to have Demi's family here on A Tribe Called Fertility to tell their story. And so here they are.
Hello.
Hi.
Thank you so
Mrs.
much.
Dominguez.
Hi, how are you?
How are you?
I'm better. I was a little emotional today. It's Charles's wife's anniversary.
Oh.
So I was reading what he wrote, and it's like, it's 5 years for her.
Oh, Kira Johnson's passing too. Yeah.
Yeah, that's this life.
Yeah. It's an emotional week. We were just talking about that while you all were in the waiting room. We were giving some background to the listeners and talking about the events this week. And it's very heavy. It's very emotional for all of us, you know. And so we just wanted to give you a moment to talk about what happened, you know, what happened to Demi and Malakhi.
And just so everyone know, we have Mrs. Tracy Dominguez, Demi's mother here.
Yes.
Xavier De Leon, Demi's fiance, and Mrs. Monique Himes, who is Xavier's mother. So again, we're just so thankful and just humbled, honestly, that you all decided to be with us to share your story. So we're basically going to let you all take the floor and just tell us the story. Tell the world the story.
Do you want me to start, Xavier, or do you want to go?
Yeah, you can start it off, and then I'll pick up from I guess after Wednesday's appointment. I don't know if you want to go after her, Mom, like, and kind of touch on Wednesday's appointment, and then I'll go after you and finish it off.
Sure.
Okay.
Okay, so with Demi, she started, you know, she didn't feel good. And she came to my house that morning and she just didn't feel good. She was swollen. And we decided to call her doctor to get her in, and they couldn't get her in. And then my sister was here and she's a diabetic. So she took her blood pressure and she said, oh my God, she's high, you know. So we decided to take her to labor and delivery. So when we took her to labor and delivery, we walked upstairs and we walked into the, I guess it's the entry room, I guess. And there was a man in the back standing there, and she proceeded to tell him what her symptoms were. And then he just said, he came in and said, well, what did you eat? And that's when she told him she had Mexican food, and he just brushed off her swelling to salt, and that she shouldn't be eating Mexican food. And at that moment, we all kind of just sort of dumbfounded and like, we didn't know what to say. You know, he said, well, if you eat pizza, you're going to even get bigger. And so then after that, some girl came in, another nurse walked in, and we went into the second room, and they took her blood pressure and they told her she was high, and it was a small room. And me and my daughter sat down, and she watched her about 15 minutes, and it was still high. And then she decided to give her some medicine, as Demi told her all her symptoms. Demi told her that she was swollen, uncomfortable. She had some vision issues and she couldn't breathe. She had trouble breathing the night before. So that's when, you know, she told the nurse, and the nurse kind of was talking and joking, I guess, trying to, you know, I don't know. To me, she wasn't really doing her job, but at that time, you know, we just were worried about Demi. So we sat there and waited. And the nurse said, well, I'm going to give you some medicine and for your blood pressure, and we'll check you. We'll give it to you. So they did that. She came back. She goes, oh my gosh, you've never seen this before. Your blood pressure is actually higher than it was when you got here when you're on medicine. And she goes, I'll be back. And she just came in and out of the room, and they took her blood. She came back and she said, well, there's protein in your urine. We're still going to monitor you for a while. By that time, it's like 5 o'clock, 6 o'clock. They came in and they said, well, we're going to admit you. And we're just waiting for a room. Still no doctor, still nobody, just this nurse who really wasn't a nurse. She's just a young, I don't know. She shouldn't be a nurse. Anyways, at that point, we waited for the room. Demi was texting Xavier telling him they decided to keep her. Nobody told us nothing except that she had protein and her blood pressure was high. At that time, nobody still wasn't, you know, we got into a room at 7:30. The nurse was trying to hook her up to register. She had so much trouble with that. By that time, it was 8:30, 9 o'clock. Xavier got off work. He came straight over there, and we sat in the second room, and they made it really dark and relaxing, try to put music on. And we sat there till like 10:30, still no doctor, nothing. And the nurse goes, well, she'll be here for 24 hours, you know? And I said, okay, well, it's 10:30. I decided to go home. Nobody said nothing. Nobody gave us, you know, any information whatsoever. So at that time, Xavier slept with her. They stayed overnight. And then the nurse, I walked out and I said, well, what time should I pick her up in the morning? She said, oh, about 2 or 3, she'll be here. She'll be here all day. And I said, okay. Well, we came home and I went to bed at 11:30. And then I wake up and start doing paperwork. And she walks in through my door and it's 7 o'clock. And I said, what are you doing here? You're supposed to be home. I'm at the hospital. And she goes, they just gave me a prescription, told me to fill it and go home and take my medicine and see my doctor in 2 to 3 days. And I said, what? And she goes, that's all they said. So at that point, I believe her and Xavier went to the pick up the prescription. And then you want to take in from there, Xavier? I guess you guys went home and she tried to actually call her doctor that morning to get in again. No openings. She tried on Tuesday to get in. On Wednesday to get in, no openings. And then on Thursday, they told her, just keep your regular appointment for Thursday. And so that's what she did. And then here we are on Thursday.
Yeah, so I'll just touch a little bit on Monday's meeting. So when Demi was at the hospital, of course I was at work. So I met them there, like Tracy said, around 7-ish, 7:30-ish. Spent the night with her, never had any contact with the doctor. Morning time came, they said, you're good to go, here's your prescription. So we did what they told us to do. They didn't mention anything about her symptoms or what they, I guess, classified it as, or if it was preeclampsia or what it was. There was nothing like that. So we pretty much just got the prescription, went straight to CVS, filled it out, and then went to Tracy's while we were waiting for the prescription to be filled. And then just carried on with our day. And like she said, that Demi had tried calling to get in with her OBGYN that Tuesday morning, and said just to wait for your regular visit on Wednesday, which was Wednesday. So that's what we did. And we were all concerned because obviously you don't go to the hospital for fun, you go to the hospital when something's wrong, and we had actually took classes those couple weeks before, and like I think a month or two before, and one of the things that really stuck to me and Demi, and especially her, was the teacher was saying, like, and I think she was a nurse as well, she was like, you know your body more than anybody. She goes, if something doesn't feel right, then you go to the hospital. And so, in that case, Demi didn't feel good, obviously confirming that her blood pressure was high when she went to Tracy's, and she didn't feel good. So we get to the appointment Wednesday morning, and we're really concerned about what's going on because we still are not in the loop. Obviously, my whole life, and I probably could, everybody here, we do what the doctor says. We're not the doctor, so we're trusting the doctor and what he says. So if he says that nothing's wrong, then we're going to believe him. So when we were going into that appointment Wednesday morning, we were all concerned about what the doctor was going to say. So we get to the appointment. Demi does her checkup. She checks her blood pressure and she says it's high. And so, I know we didn't know anything really about how the blood pressure worked or what to look for really and things like that, So when she said it was high, she was like, oh, I'll be back. She goes, maybe it's just because you're at the doctor's office, everybody kind of gets nervous or whatever. So she comes back, she takes the blood pressure again, and it's still high. And I think at that point, that's when she had Demi take a urine sample. She didn't tell us anything about the urine sample. From then, we went straight to the next room. And that's when my mom was in there, and Tracy, myself. And we're all really concerned. When we first got into the room, we gave I don't know exactly the terminology, the nurse's assistant or the doctor's assistant, all the paperwork that we got from the hospital. So we know that he got all the information we got from the hospital, we pretty much gave it to him. So when he walked in the room, he was very nonchalant, just very nonchalant. It seemed like it was like rushed. All the appointments we went to with him were, I'd say, maybe less than 20 minutes at most, maybe 25 minutes. So we were always in and out of that. He had walked in, he said, amniotic fluid is good. Baby looks good. There's there's nothing that was crazy that stood out. So we were under the assumption like, well, man, okay, we're in the clear, you know, the doctor's saying everything's okay. So that's what we're going to assume. You know, we're not doctors. We don't know anything about the medical field, anything like that. So it was like a sense of relief. He was just pretty much told us just to avoid salts, make sure she has her bed rest, keep her feet elevated. So we did exactly what the doctor told us to do. I know right after that meeting, that's what we did. We changed our whole, I mean, we had already had our diet change prior, but we really emptied out our fridge and took everything out that we had, like the least amount of salt. I know after that meeting, Tracy went to the grocery store and got us groceries and replaced our whole fridge again. Like, okay, we're really going off of this diet. So we did everything the doctor told us to do. So we carried on with life because, you know, the last thing that the doctor had told us, her OBGYN was, hey, everything's okay. Baby's healthy. You guys are good. Just make sure you rest and avoid salts. So we continued on with our daily life. You know, after the appointment in the morning, me and Demi stayed back to talk to my mom. We were planning Easter and what we were going to do. And we had just got an apartment. So we were trying to, you know, figure out a way or a day where they can come over and have dinner and things like that. And, you know, fast forward to Thursday, I think I was off or I was working, you know, I believe I was working, you know, got home, showered and stuff like that, had a dinner together, just like a normal night, any normal night, watching TV together, just relaxing, you know, and so we get ready to go to bed and, you know, we're laying down and it was maybe about 10:30ish. And I was like, man, we got to go to bed now because I got to work in the morning. And she's like, okay. So we lay down and go to bed. And I gave her a kiss goodnight and gave the baby a kiss on the stomach and told her I loved her. And so we went to sleep. And I'm a heavy sleeper. Like there could literally be an earthquake going on and everything, and I will not wake up. But for whatever reason, and it's obviously God that woke me up. But I woke up in the middle of the night and I seen her moving. And at first I was like, oh, she's just moving maybe moving the baby around, trying to get comfortable with the sheets. But I had that gut feeling that something was wrong. So I really, like, that gut feeling had me pop my head up a little bit more. And that's when I seen her jaw clenched. And that's when I realized she was having a seizure. So I immediately hopped out of bed, called 911, called Tracy, and was doing what 911 was telling me to do. So I had to give her chest compressions while the ambulance was on the way. So I really believe that Demi had passed in my arms because I remember her starting to turn blue, and I remember just, you know, keep on doing the chest compressions. And I remember she took a breath and she relaxed. And I was like, okay, her seizure's over. Like, she's going to come back. She's going to snap back. Like, we're going to be okay. And the whole time I'm like, wake up. Like, you're going to be okay, you know? And so I thought it was over. And then she went right back into it. And it was still shaking. Her jaw was still really clenched. And I was like, man, this is not good. This is not good, you know? And so she took another breath and I was like, okay, it's really over now. But when she took that last breath, you could tell like her soul left her body. It was just the difference from the first breath and her still fighting to the second one was night and day. Like, so I knew that she was gone. So at that point, like in my heart, I knew she was gone. So my next concern was my son, Malakhi, because, and, you know, I don't know really anything about the medical field, but I know enough to know that if the mom doesn't have oxygen, the baby doesn't have oxygen, you know?
Right.
So my next concern was getting my son out. So I'm still giving her chest compressions to keep, you know, just doing what I was told to do from the 911 dispatch. And so the ambulance and firefighters arrive and they take over. And they were trying to, I guess, resuscitate her or whatever they were trying to do in the room. And she got taken to the hospital. And I remember just being in the hospital in the ER, and there's a bunch of commotion going on. The way I describe it is like the movie Selena, when she's in the hospital and there's just so much going on. That's exactly how it was. And I remember just, you you know, everybody's crying and kind of screaming and things like that. And I just remember standing at one of the doors in the rooms and just looking at all these people go in and out for where they were performing the C-section. And I just remember people just going in and out, like very frantic. And I'm just standing there, and in my heart, I knew Demi was gone, but I had that small, like, maybe she was going to be back, you know, maybe they could have told me like, hey, she made it, you know. But I remember seeing the doctor walk towards me, and it was the longest 10 feet of my life. And he walks up and he goes, who's the father, who's the husband? And I go, that's me. And he puts his hand on my shoulder and he looks me dead in my eye and he goes, I'm sorry, but your wife has passed. And that's when everybody in the back, you know, hit the wall and started screaming and things like that. But in that same breath, he goes, but your son's still alive. And so they walked me over there and they were asking me like, hey, do you want to see Demi one more time? Like, and I was like, yeah, of course. Like, and they were kind of trying to not let me, just because of how traumatic it was. And they were like, she's still kind of hooked up to stuff, like she's not clean kind of thing. And I was like, I don't care, like I just want to see her. And so I remember walking into the ER, the makeshift, not, it was a room, but it was like a makeshift wall. And I remember just seeing her right there and just laying there. And I remember I walked around and sat on her left side and just sat with her for a couple seconds and told her I loved her and gave her a kiss again. And at that point, that's when I went to my son and I seen Malakhi, and he was just by himself, alone and shaking. So the first time I seen my son he was just by himself shaking. And so I was like, man, this dude's having a seizure as well. And so I remember going up to him and putting my hand on him, and he calmed down a lot. And from that point on, I walked him up to the ICU with him. So they didn't immediately take him to the NICU. I'm sorry. So I walked up there with him, and they were doing whatever they had to do. We are giving him all the stuff and things like that. And he was still having his shaking. I was like very like seizure, like very like vicious shaking. And so, I mean, obviously when you see a baby like that, that's newborn, like that's not good, you know, that's not normal. So I knew something was going on. And so while we were up in the NICU, the doctor was giving me these options. Like I had to give him permission to do the platelets and all the stuff that they were giving him. And looking back at it, so much time was wasted because he gave me the option of, and I'm not even in my right mind, you know, so he gave me the option to try to have Malakhi in a clinical trial. That's, I believe the University of Stanford was doing, where they were going to cool the baby's brain to prevent brain damage. So he called whoever he called and was like, hey, we have this baby, blah, 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 blah. And they pretty much denied him. And so he was like, well, our next step is to call Valley Children's and get a helicopter and send him over there, because here in Bakersfield, we don't have a level 4 care unit here. So my son didn't even have the resources to have a chance, really. So time was wasted with that, trying to figure out if he was even going to get accepted into the trial and things like that. So by the time they said like, oh, he's not accepted, we went into calling Valley, and they had a medevac fly over there, and they had a real hard time getting him stable. So it felt like forever. And I couldn't tell you exactly how long it took. But I believe he was supposed to be out of there by like 7, and he didn't end up leaving till like 12 or something like that, just because they couldn't get him stable. So they flew him, by the time they got him stable, they flew him out to Valley. And I know my mom immediately went over there while I had to go home. You know, I was still thinking my son's going to live. So I was like, I'm going to be at the hospital for a while. So I went back to the apartment, ran in there and grabbed whatever I could really quick, because you could still see the wrappers from the EMTs and everything still there. And it's just like, it was the weirdest feeling. Like it was the weirdest feeling ever. And right time I got back in the car from getting my stuff, I get a call from the Valley doctor, Madero's doctor, Valley Children's, and he was pretty much telling me like, your son made it here. It's not looking too good. There's no brain activity, and we're gonna have to redo 2 procedures, because I guess at Bakersfield they didn't insert, I believe it was the UVC line or something like that. They didn't insert it right. So they had to take everything out of his umbilical cord and then do it over again. So I had to give him permission to do that. And he was like, and that's pretty much what he told me. He's like, we're just going to do what we can do. And I gave him permission. So about time I arrived to Valley, it was shift change. And usually they don't allow people in the rooms when they do shift change, I was told. But, you know, God gave me that opportunity to be in there and spend some time with my son. So I remember just seeing Malakhi and on the machine and just laying there, and I just sitting there looking at him for a while, and until you know, until some of my family came in and we were all spending some time together. And I had got him baptized at Bakersfield Hospital, but before I everybody came in the room, I should say, the doctor came, and he was just pretty much updated me. And what he pretty much told me in so many words is like, there's nothing else we can do. We did everything we could for your son, but there's no brain activity. He's just a vegetable pretty much, you know. He didn't say that, but that's pretty much what he was saying, that there's nothing we can do, you know. And so at that point I knew what I had to do, and that was to take him off life support. And but before I did, I had pastors come over and prayed with us and the family. And I remember, I think it happened to some of my family members, and they would always talk about when they first changed their son or daughter's diaper, mostly sons, that they would pee on them. And I thought that was the coolest thing ever. And so I had the opportunity to change Malakhi's diaper, and I got peed on. So I thought that was the coolest thing ever, you know. And I was like, man, this little man's still here with me, you know, like. And so I changed his diaper, and, you know, I updated my family like, hey, this is what I'm going to do. So we spent a little bit more time with him there, and we prayed with him and things like that. And that's when I told the nurses, and I was like, okay, I'm ready. And so they took him off the machine, and they cleaned him up and wrapped him up for me. And that was the first time I held my son, and he couldn't breathe on his own. So in reality, he was gasping for air, but it felt like little hiccups. So that's the way I cope with it, you know. I just say he was hiccuping, and I picked him up and I walked him down the hall, and we walked into this room called the butterfly room. And I remember just as soon as I turned to look into the room, there was this big wooden rocking chair, like you see in the old movies, like scary movies, like just this big wooden rocking chair. And that's where I sat down and held my son until he took his last breath. It's a real blessing, because I got to spend my final moments with two people I loved. And I know, especially during COVID now, people don't even get that opportunity, you know. So I know I was the last person that Demi had seen right there in Malakhi. And it's just crazy. And from then, that's when before he actually had passed, we were lucky enough to get his heartbeat on the little stuffed animals that they give you. So we still have his heartbeat. And you know, we got like a locket of his hair, and the blanket he was wrapped in and stuff like that, and the little supply box that they gave you. But and that was the first and last time I held my son. And then that was it. And we went home and woke up the next day and thought I was in a dream, you know. It still wasn't felt real, but that's what happened. That's what happened.
Mrs. Dominguez, do you want to say something? You wanted to add?
You know, it was all preventable, because we all three went into that last office visit. Monique and Demi expressed her feelings to the doctor. Monique, he didn't, just brushed her off, you know.
Yeah, I saw Demi 2 weeks prior to that at my other son's baby shower, and she looked a little bit swollen, but I just thought, you know, she's working, she's going to school, it's normal swelling from pregnancy. And then I got the call that she was at the hospital from Xavier. He said that they were going to keep her overnight. I asked him if he wanted me to go. He said no. Tracy was there. Taylor was there. I said, okay. Let me know if you need anything. Then he said they discharged her. We're gonna see the doctor. I think it was Wednesday. I went to that appointment. When I walked in the room and I saw Demi, I started crying because of how swollen she was. I couldn't believe from like the first time or the last time I saw her to then how much of a difference it was. Asked her how she was feeling. She said she was having spotty vision. It was hard to breathe. She felt really swollen. It was uncomfortable. But she still smiled, you know?
Yeah.
So then the doctor came in and it's like he didn't even care. He said, let's see the baby, see how the baby's doing. And that's when he said, oh, the amniotic fluid looks good. Everything looks good, like just, bed rest. And me and Tracy kind of jumped on him like, hey, wait, what about, what is she saying to you? Like, you're not even paying attention. He didn't even say anything about the discharge papers. So then he was like, okay, I'll write her off from school. I'll write her off from work, have her get bed rest, and I'll set her up for stress testing. And we're like, okay, and like Xavier said, we stayed out in the parking lot and we talked about Easter and their baby shower. And then I get a phone call like 3 o'clock in the morning from my son, and he says, and I'll never forget these words. He said, Mom, I don't know how to tell you this. He said, but Demi died and the baby's in the NICU because he's having seizures. And I said, okay, I'm on my way. So when I got there, it was like, I couldn't believe it. I didn't want to believe it. I didn't know if it was real. So I got there and everybody was there, the family, everybody. And it was just surreal. It was a surreal moment. Like Xavier said, it's like, you see everybody crying, you see everybody, mad and pacing, and it's just like, this isn't happening. We were just at the doctor's office. This isn't happening. And I saw Tracy, and when I saw her, I knew that it was true. And it was just, it couldn't be, it was preventable. And then I went to the NICU and I saw my grandbaby, and it was just, it was sad. It was upsetting because I felt like they didn't know what they were doing. Like, I asked the nurse questions and she straight out asked me, are you a nurse? And I said, no. And she's like, are you a doctor? I'm like, no. And she's like, who are you? And I'm like, I'm his grandma. Like, I want to know what you're doing. Like, what are you giving him? What medications are you giving him? Why are you giving him the medicine?
You have every right to ask those questions.
And she was just like, oh. And, I don't even remember seeing the doctor, to be honest with you. But my focus was, to be right there by the baby with Xavier, whatever he needed me to do. So like he said, they sent him to Madeira and I got to spend 4 hours with him. And I knew I'm a medical office assistant, but it's been years since I've worked, with the patients. So when I got there, I mean, it was just a totally different environment. Malakhi was so calm. He was shaking a little bit, but it was nothing compared to how it was here in Bakersfield. And I mean, the nurse was like awesome. The respiratory tech was awesome. The ultrasound tech was awesome. It was just a calm, loving environment. Like, it was just great. And so I got to spend time with him, and they had the encephalogram on him, so they were monitoring his brainwaves. And I walked around the corner, and there was nothing, and I knew he wasn't, you know. And I was just thinking, like, how is my son gonna deal with this? Like, how are we gonna deal with this? Like, it just sucks, you know. And then Xavier came and he said, you know, Mom, this is what I want to do. And I said, okay. And like, to be able to capture those moments with Malakhi peeing on him, with him changing that pamper, with him, you know, holding him. I mean, those are precious. Those are precious moments, but it's like something that shouldn't have happened, and it sucks. And it's like, how do people let stuff like this happen? Like, how, you know, and us as parents, we're like, you know, we should have, could have, would have, did, you know, we could, if we did this would have been different outcome, or, you know. And I think the thing I struggle with the most is like, I can't protect my son from that hurt and that pain. And as a mom, that's what you want to do. You protect your kids, you know. And I can't. Like, I can only be here for him as best as I can be. And it's just, it sucks. It sucks. It sucks so much. And like, I know what happened to us, like, could have been prevented. And the fact that it did happen to us, it's like, we're going to do everything we can to make sure, you know, we can help others to make sure it doesn't happen to them.
Yeah.
And thank you guys for, you know, talking to us.
Well, thank you. I really, I can't thank you enough for your courage, your strength, telling the story, just reliving this. You know, it's a lot, because I'm a registered nurse and I'm broken up by the story because I'm angry. I'm angry because it did not have to happen. There were so many different interventions that could have taken place. Mm-hmm. And this is just, it's just a miscarriage of justice. It's just awful. Like, this is just awful. No one should have to experience this. And so my heart really, really just goes out to you. And, you know, I'm just, again, you know, grateful that you all have picked up the torch and you're honoring Demi. It speaks a lot for who she was, you know. And I know when we were talking to you, Ms. Dominguez, in the pre-production meeting, and you said that you all chose Malakhi as his name, and that means messenger. And so through you all, the message is carrying on. The message is being told. And yeah, it's just so, I'm just in my mind, I'm like, why did they send her home without like mag sulfate, you know, some magnesium sulfate that could have helped, you know, bring down the blood pressure, that could have stopped her from going into preterm labor. There's just so many different things. And then, you know, Mrs. Himes, as you explained the difference between the two different hospitals, I can hear it.
Yep.
I could hear
Night
it.
and
Like,
day.
for the baby to be alone for all that time, alone, like I can't even. And then no chaplain, no support, you know, where was social? That was so traumatic, you know. And Xavier, you're so strong. So strong, because I don't know if I could have handled something like that, you know. And it's just, and the way you did, and under the circumstances, and not really having the support in that hospital. And thank God for your family. Like, I'm just really just in awe and in admiration of your family, you know, just you all holding each other up, you know. It's wow.
Literally, we thought it was her food. Literally, I went to the Costco, I went to Sprouts,
Mm-hmm.
I bought her
Our
a
favorite
wedge pillow.
places. Yep.
I bought her a wedge pillow that night at 11 o'clock. I'm at Walmart shopping because they said, elevate your feet. So I went, okay, we'll go get a wedge pillow, you know.
Right.
And I took it to her that same night and she passed at 11. And I ran in the house because I had just gotten off work and I ran and got it at Walmart and we came back and me and my son drove it over and I said, I love you. And I put her feet up, you know, and she said, I love you too, Mom. That was it. That was the last time I see her. I got the call too from Xavier. All I could hear was, she's turning blue. And I don't, you know, at that point I jumped out of bed. I don't even know if I had clothes on, to be honest. I think I fell. My neighbors ran out of the house because I was screaming. I didn't get to see Malakhi because I was so distraught. I think, to be honest, I was on the floor in the middle of the ER screaming. So I mean, I think all the patients in that ER that night, they seen everything. And a couple of them, you know, got my kids and said, let me pray for you, please. And I didn't even know these people because, you know, they seen how much was going on and the doctor's crying and he's the one who's telling us, you know, all she needed was magnesium sulfate, you know, and proper attention, you know. They just ignored all her other symptoms. They ignored her swelling. They didn't even check her protein in the office on that Wednesday when she went back. They didn't weigh her. Yeah, they took her urine, but they didn't see if it went up or, you know, you just got out of the hospital. Why aren't you doing a 24-hour urine test? You know, you didn't read the paperwork. That's why, doctor, you didn't read the paperwork.
And you always repeat tests, you know, these are standards where you're mentioning standards of care and they were missed.
He's trying to say that, you know, like he knew that, no, you didn't read anything because you would have caught it, you know, but that's.
She had classic textbook symptoms, signs and symptoms of the preeclampsia, and she had bad symptoms. So that lets you know.
And her blood pressure kept going up and it didn't go down.
It didn't respond to the medication.
Right. She needed to stay in the hospital.
It's just
she was there. He ended up keeping her there. Well, like I said, no doctor ever went in. Absolutely no doctor seen her. Kept her 13 hours instead of 23, like the nurse told me. And I was prepared to pick her up, you know, okay, I'll go to work, I'll get everything, we'll get it, we'll work it out. That's all I said. It'll be fine. You know, that's what we thought. And then it was just tumbled. It was one mistake after another. It's just like, you know, no one
absolutely.
wanted to.
And the comment about the food and, you're swollen because you ate Mexican food. And
that part was what fueled my anger. Because first and foremost, you never want to blame, you know, the patient or blame
or the mother.
Right. You never, and then to make reference to the food, you know, just like culturally, it's just wrong. It's just ignorant and disgusting. And one of the main causes of preeclampsia is stress. It's not salt. You know, we all know that salt can contribute to elevated blood pressure, but stress is like the number one contributor. And then I was listening to Xavier saying that she's going to work, she's going to school. You're saying that as well. So those were some of the factors. And it's like, it was just missed. And how ignorant of someone who possesses advanced education to say something like that. Like, it's just so ignorant. It makes me mad.
Yeah. Well, she had asked to get off of work. She had asked to get off of work 2 weeks prior. He told her no, she had to wait till 35 weeks. She goes, well, my feet are hurting.
The doctor said that?
Her OBGYN. And her OBGYN was taking drug panel tests, routine drug panels. Drugs for
God.
What?
I can't.
Medical rate. I understand the beginning. Maybe you do that when you have a first client.
No, that's not. No,
that's not typical.
2 pregnancies. No, that's
there's
not,
actually
that's no.
Some very large hospitals who are under investigation right now in New York City because of this, because it's discriminatory. On what basis?
Right.
You know, on what basis?
Why was he doing drug panel tests? A routine one.
Yeah.
But he wasn't doing the regular tests, so he should have been doing
right. But giving
but
her
it's
a
just a
drug
panel
test.
test.
But you were drug testing.
Yes.
Yeah,
That's
he was
the
All every drug you
discrimination.
can imagine, drugs I never even heard of. He took a panel test on her.
So that's more of the discrimination and the
Yes, oh, yeah.
racism.
This is
because
evidence. It's
she's a
just so
woman of
evident.
color. Right.
It's clear, you know, and it's just, I understand why you're taking the course that you're taking, in that something needs to be done
Yes.
so that change can happen, because this can't happen again. This cannot happen.
And
It's just.
And the truth of the matter is that because we hear these we just hear them over and over and over again, that when something happens with us, and I mean women of color, when we're pregnant and we go to the hospital and we say something's wrong, we're not feeling well. It's happened to me. It's happened to Sinora when I was pregnant with my youngest son, Amari. And I went into labor and I had a planned C-section, and I just went into labor with him, and I went to the hospital, and they kept me for a little while, but I was having contractions, and they said, well, Mrs. Baker, since you're not dilating, we're going to send you home. And I was like, well, I'm dilating. I'm in labor. And they were like, well, no, you're not, because you haven't dilated. And I said to them, I said, I had twins as my first pregnancy. 36 hours of labor with my twins, with Pitocin, with every medication. I said, I only dilated 2 centimeters. I said, so with this, labor with my son, I said, I'm not going to dilate. It doesn't, I know, because this already happened. And they said, and they still sent me home, and I labored for 14 hours. And then a friend of mine told me later, a doctor friend of mine said, you could have hemorrhaged to death. Like, they shouldn't have sent you home. And I was like, I didn't even recognize that I could have died until a medical doctor friend of mine told me that. And it's just like, and this is the narrative. This is the experience, that because we're of color, it's like, well, we don't matter. Our babies don't matter. So you go home and whatever. It's almost like negligence. Like they don't care. Like we're expendable or something.
Yeah, exactly.
Well, that's exactly what it is.
Yeah,
it's exactly what it is. We have to just really just call it out, because that's the only way it's going to stop.
Like even with Malakhi, and so the doctor saying, oh, well, there's this research study. Now I'm a researcher in my profession, but you have to think ethically. Right now, should I be trying to get this baby in a research study? No, he needs to go to the level 4 hospital. Like,
he needs to be stable.
What?
Because even to transport, they know that he needs to be stable.
That is just that's not ethical.
Just drop the ball, and
that's not acceptable.
For them not to even anticipate him needing that care, knowing how she was arriving, how they were arriving to the hospital. There's so many. There's just so many. So I understand.
Was for one person to say, we're taking this baby. He needs to go. Forget your whatever. All the other things you all are trying to do.
Yeah, and they could have coordinated with Madera to say this is a study that he may, qualify for. But it's so I understand why legal recourse has to happen. I understand. And could you talk a little bit more about that 1975 law that exists in Bakersfield, California?
Right. Xavier, you're better on explaining it than I am.
She says that, but she does it pretty good too. So yeah, it pretty much puts a value on human life. That's pretty much what it's doing. And it's at 250. So in instances like this where there's negligence, a family can only be, I guess, not even compensated, but for lack of words, compensated up to $250,000 for their loved one. And we all know you can't put a price. You couldn't pay me any amount of money to be okay with what happened to Demi and Malakhi. So, and that law has been around since 1975. So it's preventing people from getting justice and even having a voice, because we had no prior experience on anything legal to this matter. So we were navigating uncharted territories ourselves. So we can only imagine other families that maybe have a language barrier, or just don't have the right resources, or just don't want to step out, because when they do ask prior, they're like, oh, you have to do XYZ. Then that just feels like the tallest mountain that you have to climb. And that's how it felt for us. But, you know, thank God that we went through with it. And that's the only reason that we were able to, and because that's where we got our strength from. We knew we had to fight for our family, but a lot of it comes from Jesus Christ, because he's the one that gets us up in the morning. But yeah, so that law is pretty much just putting limits on families, and allowing them to either get justice, which helps with closure, and it's just putting a value on human life. And we all know that there's no amount or anything that can replace that void in our lives. So it's something that needs to be changed, and it needs to be, at bottom line, it just needs to be changed and looked at, really.
Yes, it
because
does.
it's if it does, it's going to help a lot of people, and it's going to hold the doctors more accountable, because they're going to know, like, oh, okay, if I don't do my job up to the standard, then there couldn't be repercussions, more, not just, oh, I'm just going to pay X amount fine, because I know maybe a majority of the families, especially minorities, don't have X amount of money for legal fees that are just laying around, you know. And we struggled with that, you know. So it's just something that needs to be changed, because it's going to help a lot of people.
You know, I just wanted to say to that $250,000 cap, just to kind of frame it for people. Some may say, well, that's $250,000. That's enough. No, it's not. When you're talking about legal fees, when you're talking about discovery, when you're talking about hiring expert witnesses to go over, you know, medical records, even just a medical record, what you have to pay to get a copy of your own medical record. It's so expensive. That $250 could be eaten up just in fees alone.
Right.
You know, and I can just tell from just talking to you all and feeling your spirit, you know, it's not about money. But the thing is this, you're living with trauma now for the rest of your lives. You're going to need support. You may need therapy. Whatever you gain from that, you should be able to use that to help you get through this. And $250,000 should not be eaten up for, you know, to prove your case.
No.
It's just disgraceful. And what it does is it lets them off the hook. Yeah. Because that's nothing for a hospital. I mean, like, let's be as a nurse, I've had to carry $6 million in malpractice insurance. So $250.
We've all spent up to $30,000 already out of our own to get to this point. We are now representing ourselves, because attorneys don't pick up malpractice cases because there's not enough money in it. And like you said, the expense of the fees, and they don't get anything back. It's just, you know, so unless that cap is changed, then we'll have justice and we'll have access to the courtroom, especially with people of color. You know, we were blessed to come up with the 30,000 on our own. I mean, like I said, the medical expert fees are 10, 20,000, you know, and people need to be able to have access to the courtroom. So that definitely the MICRA has to be changed in California. A lot of people don't know about it. We didn't know about it until we've experienced it. I feel like our story is the face of MICRA, because I've already paid 30,000. Some people just give up and don't do anything, and you know, they can't. They don't have, you know, we were fortunate that we were able to get to this far, and now we're representing ourselves. And you know, that's another prayer in the air, you know, God's grace, so we'll get through that part. But you know, we want to make it access for everybody. That's why we push sometimes the MICRA to make it change. And then, you know, we're fighting that, and we're trying to make, you know, in California, we're trying to talk to senators and get a policy for women of color. But also that will work all, but the bottom line is we also need negligence in these bills. They have all these great bills and extra stuff, but they're not talking about, we need to make doctors responsible. So that's what we're fighting right now. And, we have a great senator who has supported us, Senator Melissa Hurtado. She's out there pushing for her community. She stood up for us, and she wants change, and she wants accountability. She wants accountability, transparency in the medical board. We're fighting, that's another issue, the medical board in California.
Right.
They're all in bed.
Right.
Yeah, they're all entwined together.
They're all entwined. And I commend Senator Hurtado for taking this on and actively doing something about it. And so Wednesday is also a very important day.
Well, they actually moved her bill to the 28th. They pushed her back because, but maybe God has a reason. Her story, a lot of people are getting her bill confused with the other senator's bill, but the difference is her bill has the medical negligence and accountability and tracking how many doctors have harmed women, keeping a track of that.
Okay.
That's very important.
That's so important.
Very important.
Paying attention, hearing your patients, caring, taking care of the whole family, not just, you're really taking care of the whole family. You're not just, our life, when Demi and Malakhi passed, our lives just begun in this grief. Now, for, like you said, for the rest of our life, this is who we are, and if we can say one person, then you know what, thank you, God. If we could say more, let it be your will, and that's why we pick up. It's hard, believe me. Just getting up in the morning, I haven't been back to work because I don't know how to get to that point of moving on. Still, it's like, it's weird going places, and my family's been devastated, destroyed. But we have our faith, and I just keep thinking she's with her dad, and they're waiting for me. Like I always say, I can't wait to go now. Feel that way before. It's not the same. It's just our lives have totally changed.
Of course.
The impact is tremendous. It really is. And Dr. Clack, could you speak to that trauma?
Yeah, let me briefly introduce. I know you guys, who's this lady in this room not saying nothing? We don't know. You guys, I didn't part of the conversation yesterday. But so I was brought on board by Sinora and Dr. Gio and their group to provide support primarily around emotional wellness. Emotional support is kind of the role that I play. And so not just for her families and the individuals she's bringing on, but for them too. And as I've gotten to know Sinora and Gio, I can honestly tell you that what you see and experience from them right now is authentically them grieving with you. And it's so much of an impact that I'm really getting to feel myself, their heart for the work that they do. I knew what they did, but now I really see the connection that they have with your story, and me too. And the one thing that I wanted to share around, you just made a great point, and I'm going to say Miss Tracy, because I think I'm going to say your last name wrong.
That's okay.
Okay, Miss Tracy. You made a point that we are just at the beginning of this battle because we have a whole legal history behind us and before us. But with that, your grief yet, right? The grief is just now starting as well. And you don't have the grief of someone who may have lived 90 years, right? You have traumatic grief because it was something that could have been prevented. So you have to live with the thought of, wow, what if this didn't happen? What if? And that compounds your grief. The trauma is what compounds your grief. And so I know you have your faith, which I am so glad to hear, because that's our number one hoping, our number one resource in terms of who we believe in. I heard Xavier say Jesus Christ, amen to that. But I'm wondering, I know you have each other. I also want to know, what else are you guys getting by way of support? Have you started any therapy, any compassionate groups or cares or circles reached out to you? Where are you guys in that process of getting some more support?
Well, I think for me, I had a friend and family take me to grief share, but as a community coming to us, nothing. You know, Bakersfield, they know my story. It's been on television, but I mean, for that, we've had to actually look at for ourselves, huh? Wow. But, you know, I've reached out to, you know, for me, what I did is I went to every pastor, couple of fathers in churches. I was kind of like, what, I don't know what I was looking for. I wanted them to tell me it wasn't true, it didn't happen. I couldn't cope in my head was going, it was like crazy. You know, I couldn't understand it for a long time. And still to this day, it doesn't seem real, you know, but I did go to grief share. They did help a lot, but you know, that's about it. And, you know, as far as community wise, wouldn't you guys say? Just grief share?
Yeah, for me, I haven't done anything. I can be honest with you. I think I just threw myself back into work, kept myself busy. My son gave me a book because he's going to a grief share thing. And he's like, Mom, I got you this book. He goes, I want you to read it. But I haven't opened it yet. So I have littler kids too, Xavier siblings. So I think for me, I just keep busy because when I slow down is when it's rough.
Yeah. And everybody's journey is going to be different. So how and when you're ready to seek support, you'll know when. You'll know when, and whether the community comes and reaches out to you or not, you'll know when you need to go further and get the support. And I wanted to speak to Xavier as a dad. You know, one of the things I heard this week, because this is Black Maternal Health Week, and all week long, we have heard and statistics, we heard people tell their narratives. And one of the things that someone said, and I never thought about this, is that if a spouse passes, it gives a name for that person. That person the surviving person becomes a widower or a widow, right? But there isn't a name or label when you precede your child's death. And sometimes people don't recognize, not even having that identity, what that means emotionally. And I wanted to hear from you, Xavier, just from your heart, like what's this been like for you? And how has grief share been helpful for you?
For me, it's life-changing. I lost everything. I had just got a new job. Just was in the apartment for like 8 days that we just got. So went back living with my pops, and suffered really with my identity. If I'm honest with you, you know, I was always, at first I didn't really, well, I was just in grief, but I mean, I still am to a lot of people. I'm always, oh, that was Demi's fiance, or that was Demi's. And it took me almost 2 years to really grasp, like, I'm Malakhi's father. So now it's up until recently that I have started saying I'm Malakhi's father. It was always Demi's fiance. And I really almost forgot about Malakhi. I never mentioned it. And so that's something that I went through, and it's something that I'm starting to speak up for, because I really am his only voice, you know. So it took me almost a whole year for me to even get in that identity of I'm Malakhi's father. And it took me just about 2 years just to get into grief share. But I remember being with Tracy. We would go to prayer rooms, we'd go to church, we did everything together. But it took me almost 2 years to get into grief share, and that's something that's really helped me a lot. And I think a lot of it too, even though it's a bittersweet thing, is just continuing to talk about it and continuing to share the story. I feel like that's one of the biggest things that helps me. Even though some days are rougher than others when I tell the story, of course, because, you know, after I tell the story, I'm mentally and physically drained. Like, I could really feel it in my body and things like that. But it was really just a suffer an identity. I didn't know what I wanted to do from there. but thank God I stuck to the plan, you know, and just really stayed. I feel like I knew God my whole life. Went to a private school, everything, altar server, everything. But I feel like up until when everything happened, that's when I really started to have a relationship with God. And that's when it really started to, I guess, in a sense, get my attention. Like, okay, this is really a whole different level of what I thought it even was. You know, I was barely scratching the surface, you know. So for me, it's just started barber college, did that. I didn't even realize like I was a zombie half the time, you know. And just trying to rebuild that identity. Got back and getting my license as the financial professional. So I started getting that. I did that prior. And a crazy thing, kind of off topic, but a crazy thing is that it's crazy how God works, because I was actually one of the agents that helped write Demi's life insurance. So it's crazy how it comes full circle. It's really crazy. So for me, it's just getting back on the plan. Something we planned is while she was going to finish school, graduate, she was going to proceed to get her master's part-time. And when she was done with that, I was going to be able to go to barber college and do that, as well as the financial profession. So for me, it's just sticking to what we said, and I'm almost done with school. And so it's just getting that identity back, a new identity. I know I'll never be the same, but it's just a constant struggle day by day. But I always, you know, I never understood what my grandpa would tell me when I was younger. It's day by day, day by day. And I never really knew what that meant until everything happened. And now I sound like an old man all the time. I'm like, day by day, man, day by day.
You do. You're very wise. Very wise.
I have to say to Mrs. Hines, because something that you said struck with me. A lot of things you said, but one thing about being a mother, and only thing you want to do is to be able to, you know, ease your pain of your children. And, you know, as they get older, just those things that my twins are about to be 10 in May. And I'm like, oh my God, I can't believe they're going to be 10. But the things that, you know, they reach out to you for, that they want help with, just like those things change, but it's still, you know, they come to mommy for something, you know? So it's just those shifts. But I have two boys and a daughter. And I just have to say that if my sons, you know, were where Xavier is, and in the same situation, and they handled themselves in the grace and the courage and the strength and with the faith that he had, you know, for any human being to have to endure, you know, losing their spouse and then to lose their child. No human being should have to endure either one of them, but both of them at the same time. I'm just in awe of him. So, you know, for both of you, you know, Mrs. Dominguez, I know you're his mother too. And just, you know, the love that you all, it's just the love that you all have, is just so evident and clear, you know. So I don't know if that brings you any grace or any peace, but if my kids, you know, at his Xavier's age are just, I would be so just so happy. I mean, just so amazing to see, and proud to see that. And, you know, and also these situations sometimes can make people, you know, just have distance. And the fact that it feels, you know, to us like it's brought you all together, you know, even more. And that's just a testament of the love that you all have. And I don't think the average set of people could do that. So I just want to commend you all just for, you know, the love that you all have for each other, the love you have for Demi, the love you have for Malakhi, and just supporting Xavier. And Xavier, you just being this epitome of just an amazing man. I have to tell you that.
Oh yeah. You all raised wonderful, wonderful child, wonderful man, because he's now an adult. But you all, I mean, you just, it's amazing, you know.
Well, honestly, I mean, to add to that, you know, Demi was such a strong believer herself. As a child, she grew up in church, and I think that's what helps us too, knowing that we're doing what she wants, and we're fighting for Malakhi like she would fight, because she would fight for her son, just like Xavier's fighting. And she's happy because I get my strength from her, because I would think, okay, what would she do? Okay, then I pick myself up. And she wanted Xavier to go to barber school. Like I said, they had a plan, but it unfortunately changed. But I know that she's watching, and she's like happy, and she's encouraging us to keep pushing and to make a change for other mothers. I think, because she's a strong-willed girl. She had her plan. And they'll tell you some stories, but she always had a plan, and she always wanted the best for everybody. I can honestly say that about my daughter. Her friends would come over and, okay, well, what are you going to do for your future? Let's get on the computer and let's get your plan out. So I know that they always think, okay, because they're all devastated and extremely still struggling. And that's another thing that, is hard to they're so young, and there's no groups out there for the young for their age. So when they were going looking for grief share, it was older people who had just lost their dad or their grandpa, older 60, and they're like, we cannot relate to that. So a lot of them stopped and had to do it on their own or go to, privately. But that's another thing that, the young people don't really have anywhere to go. And, we had Bible study here. We did our stuff for a good year, faithfully, a good year, twice a week. We'd have Bible studies here, and just so we'd stay. We couldn't sleep. I don't think I've slept in 2 years now. I sleep, maybe I get up. That's the trauma. I don't have a good night's sleep. It's never going to be so. But our faith is what actually has carried us, and there's some letters that Demi had wrote that talk about her faith, so keeps us going. And it's like you said, we're all closer to the Lord because, we want to get home with them. Eventually, be together as a family again.
Yeah. I don't want to cut you guys off, but I have to go to work now.
Okay.
It's okay.
Thank you guys. Thank you for everything you're doing. And I'm blessed to have met you and talked with you guys.
And same here. Thank you so much. Even though I cried this whole time, this filled me up so much, because now I'm like a woman possessed, because now I want to do whatever we can do to help this situation.
Fire is spark. Yes.
And honor you all for what you're doing right now, so in any way that we can help and provide some resources, we're going to do so.
To the case.
Well,
and,
yeah.
Yep.
Thank you.
So thank you. Thank you so much.
Bye, you guys.
Bye, Mom. Love you.
I love you.
So we're pretty much, I think that wraps it.
Well, thank you guys for allowing us to tell our story.
Thank you so much.
You. It's crazy how God works. He connects everybody across the state and everything. So it's crazy. Yeah, exactly. So everything that we have came across, or everything that we do, is just because of him. Going back to when everything first started, when we got the opportunity to speak at the doctor show, we weren't writing letters in or doing anything like that, and we got chose to tell the story on there. So just very thankful to God and for Jesus Christ to be doing all that he's doing. That's it. At the end of the day, that's the answer.
Amen.
Right.
That's the answer.
Amen.
So we're just, I know Tracy is too, just thankful to be one of his chosen ones to carry
That's
this
right.
To carry this torch, because it's not easy, like she said. And it's like you guys said, it's the love that we all have for each other, because when one falls, I know we pick each other up, and we all have our different days. So but thank you again for the opportunity. We really appreciate it. And can't thank you enough.
Thank you.
All right.
Oh, we good? We're good? I don't want to cut everybody off. I'm sorry. I know.
No, we're
Xavier, do
Unless
you want
say
people
anything
to
else. Yeah.
do you want people to follow you on
we forgot
social media?
So sorry.
Oh no, that's okay. Or the handle.
We have Demi's page.
Page. You want to tell folks how they can follow and help support?
Yeah, so I don't know like the exact, I think Tracy, if you can put it, I don't know if we have option to put it in the chat, but maybe you can just say that one. I know
yeah,
it's
we have it
Justice for
too. Yeah.
Demi. Oh, okay, so
Yeah, Justice
if
for
you guys
Demi.
follow us at Justice for Demi and Baby Malakhi, and if you guys want to spread the love even more, my personal is Xavier, Zavey, V as in Victor, and then 2 underscores. So yeah, that'd be amazing. Yeah, I would appreciate that.
Awesome. And we're gonna have
and that's
all
on
this.
Instagram. I'm sorry.
That's on Instagram. Okay, great. Yeah. And we're gonna have those handles. We'll have those handles placed on the episode on our website, itself. So it'll all be there, so people can follow you all.
People can easily find them.
Feel free to give donations. Do you all still have the GoFundMe?
Yeah.
Yes.
That's still open. Yeah.
So we need, we need that too. We need that link too.
Yes.
Okay.
But you can text it to me too. I have your number.
Right?
Yeah. Okay. I have your cell phone number.
Yeah.
Okay, perfect.
So I can just text you and say, hey, it's Dr. Jill.
Yeah, and I want to stay in touch.
Somebody you know.
Yeah. Stay in touch. Okay. If you need something through school, Dr. Jill's a professor. I'll do whatever I can within my network. Yeah.
Yeah. Thank you so much. So much love. Appreciate it.
Yes.
Really
You're welcome.
Appreciate it.
You're welcome.
You're so welcome.
And listeners, please make sure to follow A Tribe Called Fertility on Instagram, Facebook, and Twitter. Feel free to DM us with your questions and thoughts or to share your fertility story with us. For more information on your superb and beautiful podcast host, visit www.atribecalledfertility.com.
And if you're listening to us on Apple Podcasts, please rate and review us. It really helps the show, and we welcome all of your feedback.